My early years as an emergency physician were spent in the U.S. Army. I found myself taking care of patients in the Iraq conflict and soldiers on the front lines. What I realized was that technology scaled in a really interesting way to help save lives. When I started thinking about what were we going to build here at 98point6, the first observation I had was I didn't like what was going on in the market. All the traditional telemedicine players were using the same locum tenens physicians as part-time contracted hires. And what I knew from that was there was no way to control quality. We wanted something different at 98point6, so we had to start with the physicians. So we decided we would hire our own doctors full-time, make them employees of 98point6, and essentially be part of the company like a software engineer would be. We knew that would be fundamentally different in the market, and ultimately that would impact quality of care in a positive way. Virtual care that is primarily text-based has a number of advantages as well. For one, we can provide transcripts to patients in real time. So that's something that's never been done in the market before. So when patients finish their visit, they actually go back and review, what did the doctor say to me? And that's incredibly valuable. It also allows you to create new measures in quality because you can actually go back and look at what happened in the conversation between the patient and the physician. We're reviewing actual transcripts and making decisions as it relates to quality and the evaluation of quality through that lens. Physician collaboration is fundamentally unique at 98point6. I don't think I could have described what it was going to be when I joined. But I can tell you what it is, which is just fantastic and amazing. What we'll find is that you may have a number of physicians in the clinic actually seeing patients, but you have a far greater number of physicians on Slack with those physicians, collaborating, talking about cases and supporting each other. This is something that has been really lost in traditional practice that we're really bringing back at 98point6. It really has an impact on physician burnout. No longer are they isolated by themselves in a brick and mortar practice. They get to talk to each other about cases, bounce ideas off each other. If they're not familiar with a certain disease process, there's other physicians on Slack who can provide real-time feedback. And from that perspective, they really enjoy not only the practice of medicine at 98point6, but having the capacity to impact what we're building at 98point6. This is fundamentally unique for them and really exciting.